In regards to the presentation, I'll start by providing a quick overview of Everton in the community, and I'll then move on to the actual intervention which took place earlier this year. Everton in the community is the official charity of Everton Football Club. It was set up in 1988, and we're looking forward to celebrating our 27th year anniversary in February. Over those years, we've evolved and we've grown massively. Initially, we were focused primarily on football coaching and sports coaching. As I mentioned, over the years, that focus has changed to focus more on the social determinants of health. So what we do is we will recruit people who specialise in particular areas such as disability, employment, education, and we will build programmes around these individuals. We will create teams, and we're at the stage now where we have 72 full-time staff, 56 part-time staff, 27 apprentices and 148 volunteers. We engage with over 15,000 people each year, and that's allowed us to become one of the largest, most successful and most diverse sport and community schemes in the world. Across the charity, the 4 primary delivery pillars are sport and disability, health and wellbeing, which I'll come on to shortly, employment and education, and youth engagement. Across these 4 pillars, we deliver 53 community projects. These are projects which support a whole range of different population groups and help to tackle different social issues. We're also in the process of developing 5 capsule projects, and the idea behind that is to allow us to position ourselves in the heart of as many communities as possible. And that leads me on to the next slide. The blue dots represent each base where we deliver activities from. So as you can see, we operate on a mass scale across the city and also the wider area. Okay, so I mentioned I'd come on to the health and wellbeing pillar. Liverpool, as we're very much aware, is a very deprived city, the most deprived local authority in the country. And with this deprivation comes a number of serious public health challenges. One area is around chronic disease, NCDs. So what we do is we create projects to help prevent cancer, heart disease, type 2 diabetes, obesity, and we also design projects to help people who are currently experiencing these conditions too. A second area is around mental health. There are strong links between mental health and chronic disease. So we've worked in partnership with Medicare NHS Trust since 2007. We currently deliver 5 projects whereby individuals diagnosed with mental illness are referred onto our community-based activity programmes. The third area is what's being mentioned a few times today in regards to the ageing population. One project in particular is called Passing the Memories. This is a dementia project, and it's been set up in the response to the estimation that 1 in 3 people over the age of 65 will develop dementia. So there's a project there to support people who are living with dementia and also their carers. We also deliver an MI project, and across all of the projects we've had huge success. One of the reasons for this success is the Everton brand. Now, the Everton brand has got huge pulling power. It allows us to be able to engage with people who don't usually engage with the mainstream level initiatives, campaigns, and generally population level approaches on the whole. Population level approaches are the most cost-effective way of improving the health of a nation or a population. However, they can actually widen health inequalities, and that's where Everton in the community can complement these deliveries, this delivery to target the individuals who are more resistant to the mainstream delivery. One example of this is some work we set up in 2006. This was in partnership with the PCT at the time in response to the Everton ward being classified as having the 2nd highest rate of bowel cancer mortality in the city. So out of 30 wards in the city, the Everton ward had the 2nd highest level of bowel cancer mortality. So what we've done is we engage with the public as social hotspots. We went to pubs, we went to betting shops, we went to barber shops, taxi clubs with health practitioners dressed in Everton tracksuits to initially engage with people using football as that engagement mechanism, using Everton Football Club as that mechanism. And during the conversation, we would feed in key messages about the signs and symptoms of bowel cancer in a very non-clinical, informal way. We also supported this on a match day where we got a captive audience of up to 40,000 people. So as I mentioned, in 2006, the Everton ward, as you can see here with the red bar, was the 2nd highest in the city. The yellow bar is a citywide average. If we move forward 2 years, the Everton ward had dropped down to the 8th highest. If we move forward 2 years again, it had dropped down to the 16th highest. It was now below the citywide average. This has been attributed to the Everton in the community intervention. So a quick summary of that intervention, which stemmed back from 2006, it shows the impact that Everton in the community can have with reaching the harder to reach population groups and the people who generally have the greatest health needs and also multiple and complex health needs. And this is one of the reasons why I was so keen to work in partnership with the North West Coast Academic Health Science Network. I could see the real potential that we could have with that. So in terms of the intervention that took place earlier this year, it was regarding AF, which is being mentioned today. And for myself, there were two key areas. One was around raising awareness. As we can see here, 15% of people who, 15% of strokes caused by AF occur in people who don't know they have AF. So initially it's around raising awareness and helping to increase screening uptake. The second issue is around lifestyle behaviour and the risk of developing a stroke. So those are the two areas where I felt we could really support this initiative. One, raising awareness. Two, reaching the people with the greatest health needs. In the lead up to the event, we had a story on the website to help raise awareness. The website receives 700 views per day. We also got a former first team player involved, John Bailey. John Bailey's a former FA Cup winner in 1984, and he's somebody that the target audience of 50 plus can relate to and engage with. This is John on the right during his FA Cup victory. What we also done is we set up the actual testing station at Goodison Park. So what it then enabled the public to do is, one, to visit an iconic football stadium, and two, to meet a former first team player. On the actual day, John Bailey was there himself. He, as you can see, got the test taken himself. There was an opportunity for the public to meet John Bailey, to have a chat with him. And straight away, as I mentioned, one, it takes away the potentially daunting clinical setting of a hospital or GP practice. It allows people to come to a Premier League football stadium. It allows people to meet John Bailey. Across the whole city, there's a number of testing sites which was set up. Across all of the testing sites, there were over 400 people tested. At the Everton Football Club site, there were 48 people tested, which equates to around 12%. So we did help to increase awareness, we did help to increase uptake. What was more of a highlight for myself was that across all of the sites, there were 12 abnormal pulses detected. Now, from those 12, 4 were detected at Everton Football Club, which again shows we were able to reach people with the greater health needs. So although we tested 12% of the total sample size, we were able to reach 25% of the people who had an abnormal pulse. What we also noticed from this is that it becomes somewhat of a model of good practice. So we wanted to, rather than reinvent the wheel, to replicate this practice. So what we've done is we've substituted the actual focus from AF to different conditions. We've worked with different partners too, and we've used the same model to have success in these areas. So with AAA, abdominal aortic aneurysm, we've had huge success working alongside the Royal Liverpool Hospital. We were able to increase screening uptake by over 3,500%. What we were also able to do is increase the number of aneurysms identified by 20%. So again, huge success with that campaign. Sudden cardiac arrest, we were able to screen 80 young people with one significant heart defect being detected, so potentially saving a life there as well. And again, using this model, we're looking to do further testing with blood pressure, known as the silent killer. NHS health checks, these are offered to around 90% of the population in Liverpool. However, only around 1 in 3 people take that offer up. This is an area where I feel, as Everton Football Club and Everton in the community, we can support with increasing that uptake. And the final two, hepatitis C and HIV, these are two conditions which also had a stigma attached to them. So using the football club, using 13 players, one, we can help raise awareness, but we can also help to tackle that stigma and help to normalise that testing to take place. There were also a couple of unexpected outcomes. What we also found on the actual testing day was that it became somewhat of a social club. In a normal hospital setting or GP practice, generally the person will go straight in, have the test taken and go straight out. What we found at our testing site, people would come in, they would have the test taken, they would then sit down, have a tea or coffee and have a chat to people who were like-minded, have a chat with John Bailey. And as I mentioned, it became somewhat of a social club. So it also incorporates that social aspect, which Andy Burnham mentioned earlier on, which is so important. Another unexpected outcome was actually a lovely romance story. Our media lead, John Howard, who sat down here today, He met up with one of the research team on the day, and they've since been dating, and now they're expecting the first baby, which stems again from the intervention back in June. So a nice little story to finish with there. And again, another thank you to the academic, the North West Coast Academic Health Science Network. Okay, thank you.